Hi, everyone. Welcome to Coffee Time with Masterminds. I am super excited today. Oh my God. What a great show. And you probably noticed I am alone without my co-host. Peter Blakely from Blakely Consulting has taken the day off. I hope she's enjoying herself. And Rebecca woke up and she wasn't feeling too well. Rebecca Tuttle from Grant right now. And so I told her to sit this one out. I got this. And I got it because we have a special guest, which I will introduce in a minute. So, as you know, we started this show over a year ago because we had entered a global pandemic, something most of us have never lived through. And as nonprofit leaders, we had no idea how to navigate these new waters. And so we came together and decided, let's have a conversation every Friday about what it's like to lead during a pandemic. We thought at most we would be here for 6 weeks. This is episode 60, I believe, or episode 61. So as you can imagine, what's even crazier is that last year, May 22nd, 2020, we had the same exact show. We were talking about reopening then. And the states were lifting the shelter at home mandate. And so nonprofit organizations were gearing up to get ready to come back to the office. And some did, but some have not. And so here we are a year later. Many of us are vaccinated, and we are now planning to go back. And some of us are going back full time. So here's my special guest, Dr. Christine Montgomery from Clifford Beers, Vice President of Community Services and School Services, Community and School Services, sorry about that, is here because as a leading nonprofit in New Haven, Clifford Beers has had to think about how do they return to the office. And many of them are back, some are still at home. And so we get to talk about how that looks like today. Another thing is we also revisited the episode we did last year, and we went back to the executive director that we spoke to a year ago to check in with her and see where she is. So it's going to be a really exciting show, and I'm writing solo, and I'm going to make my co-host proud. So let's introduce Dr. Montgomery. How are you?
I'm good. Thanks, Cynthia. So glad to be here.
Yeah, we're so glad to have you. And I just want to be really transparent. I work with Dr. Montgomery for 15 years.
Yes.
And before we wore reading glasses, we didn't always wear reading glasses.
True statements. Yes.
We went through a lot of milestones together. So it is so nice to see you and to have you here. Thank you so much for doing this.
Thank you, my friend, of course.
Yeah. So let's talk about Clifford Beers. Where are you guys in terms of going back to the office?
Sure. So obviously the past 15 months, who would have ever thought that's where we would have been in March 2020 when we originally shut down? At that point, we closed all our locations within like a week. We started talking about COVID, and a week later, we closed all of our locations, shifted to telehealth services, new platforms, working from home, all staff working from home. Eventually, we gave up some rental property and reduced our footprint, like many, to just really reduce some of our costs. We workspaces, we redefined locations, we came up with continuity of operation plans to continue to provide services. We thought about our IT needs, the need for support with so many people working from home. And really, we really thought about also what needed to remain, what was essential that needed to stay open. One of our mobile crisis program for children and families has been open the entire pandemic. So going to people's homes throughout. And we also knew that so many of our families were struggling with food insecurity. And so we had a gift card distribution site open also. So for the families that we were working with, we gave out almost $70,000 worth of gift cards. Year.
And you did that from the office?
We did that from our office location. So it required COVID screening and health screening and on-site But yes, we were able to do that from one of our locations. We actually did it contactless, set up different situations, use different parts of the building to kind of secure our spaces and to really not have contact with our staff and our families, especially during the height of the pandemic.
Wow.
I say all of that because we've really thought about client needs, staff needs, program and funder requirements throughout this past 15 months. And it's really forced us to kind of course correct quite often and adjust and be more nimble than I even thought possible. I guess that's kind of what our past 15 months have been about. We are now very much so defining the new normal. About movement towards, a fuller opening, I'm going to say, or being more open.
Yeah.
I'm happy to kind of talk with you more about what are some of the pieces that we're considering as our new normal.
Yeah. Well, I'm also saying good morning to some of our viewers, and usually Rebecca handles the comments. So, hello, good morning, Renee. Good morning, Myra. I am writing solo, so I'm going to try to manage it all. This is so much fun. I got to tell you, I'm having way too much fun here. But so this is interesting. And one thing I do know about the agency is that because you work with young people, right, being careful during flu season is part of the organizational culture. Right. So I was there for 15 years. I got sick twice in 15 years, which is amazing. Right. And so there was some behavior already in place. Right.
Yep. So we are lucky enough to have nursing support on staff at Clifford Beers. So we really, during COVID, were very intentional. We had COVID planning meetings all the time to really think the different phases of reentry and return to work. And as I'm talking about the gift card distribution, we came up with contactless gift card distribution because of our, through kind of collaboration with our nurse manager who was there, our infection control coordinator. That's her official, if you will. And so again, we really thought about client needs, program needs, staff needs, and everyone's overall safety, but also very much remained a mission-driven organization that knew that our families needed us to be open, and just what that open looked like was really had to shift over the past year.
Yeah. How are staff ready? How do you think staff feel?
So we have gotten a lot of staff feedback. We've been extraordinarily, in my opinion, generous with staff. We recognize the challenges that our staff have had over this past year as well, as they have, many of them, parented with and schooled their kids while also working full time and supporting the families that we work with. So we really recognize how just complicated this past year has been for all of us. Some of our staff really did request to come into our office spaces. They found that it was a way that they could kind of contain their work in a different way and really stay focused on their work. So we came up with different capacity numbers for different rooms that we had at the office, at our different office locations pretty early on, just really wanting to recognize and acknowledge and meet our staff needs, that some of them really wanted to come on site. Others did not. And so we really, we looked at program client need and program level need and staff needs throughout the past year. And as we're kind of planning, we, as essential workers, we were in the early phase of the vaccine rollout. We had conversations. Do you mandate vaccine, or is it optional and voluntary? We landed on that it's optional and voluntary. But that was a very real conversation that we had to explore and kind of think about for our staff. We've also really thought a lot about, at this point, with our funders are saying they'd like us to return to more routine operations as the state is now opening up, and
Wow.
if the mandates have lifted around, in our state, that, we're looking at different work groups. So we've established some different work groups from kind of like clinical care and what's going to stay in kind of a telehealth world and what's going to return to our office locations, human resources, HR and compliance type work groups. What would work from home policies look like? Will we continue in a hybrid space, which is what we're imagining? What are the core work hours and work operations? I think that was probably one of the trickiest parts. When you're working from home, you're always at home. So are you always working?
Mm-hmm.
That was the reality. We were working like crazy bananas hours. And, trying to now, if we're in this hybrid space and this different new normal, then we want to contain and come up with kind of core work hours again, and really think about workplace culture. If we're in a hybrid workspace, which is what we intend to be in,
Mm-hmm.
for the foreseeable future, we do not imagine going full on site, every location, full time for right now. We imagine remaining in a hybrid workspace. So we're creating kind of norms around that and really thinking again about kind of work-life balance issues again. And also leading by example. So I am a vice president at the organization. I could do most of my work from home, from my dining room where I am right now. But if I'm asking my staff to come in, Lord knows I'm coming in too, because that's what leaders do. We lead by example. We show up when we need to.
And I do want to circle back to that, but I do want to bring up a comment that we got from Myra. She says, so Myra works for the Department of Ed in New York City, and she says that the DOE is reopening will be challenging, but we're starting self-care for teachers as many are overwhelmed with the return. What a great idea. The interesting thing is last year when we ran the show, one of our viewers asked, what are going to be the mental health needs of staff and how are nonprofits supporting that? So are you guys doing anything special for the staff as you transition?
So, I mean, I do think we've been, we've given staff extraordinary flexibility around their work hours as they were balancing so much within the past year. I love Myra's comment. So we also do a lot of professional development and community training in our New Haven community, and we do it on like kind of trauma and being a trauma responsive organization. And we've done a lot of self-care workshops this year as well for public school staff, for early care educators, for camp counselors, you name it. And also for our own staff. We've thought a lot about the care of our staff this year. Absolutely.
Yeah. And so let's get back to the point that you were making, because I thought it was a good one. You said, as leaders, we lead by example. A couple of weeks ago, we ran an entire series on equity. And of course, there are equity issues in terms of our new way of working. And so tell me a little bit about, are those conversations that you're having? Who gets to stay home? Who has to show up? And are people talking about the inequity in that?
Yeah. So, the reality is if you work at Clifford Beers at our front desk, that's where your primary location is. You're greeting clients who are coming in, you're answering the phones. We are very proud that we were able to keep everyone 100% employed throughout the pandemic. And so that's including our front desk staff. We did that by, we opened a warm line, a call-in line for the state, initially for the state, and eventually for the state. And so we trained up those staff who, again, they greet our clients all the time. So who better to kind of staff that warm line, if you will, than our front desk crew. And so, so they were doing that. So again, we in the early stages of planning for kind of the shutdown and how work was changing, we thought a lot about ensuring that people continue to be employed at Clifford Beers and be productive at Clifford Beers. But yes, there are some jobs and some roles that can only be done, like our mobile crisis program, for example. If you're in our mobile crisis program, you were mobile throughout the pandemic. And so, we made some accommodations for those staff who were committing to doing that. As a result, because that felt like the right thing to do.
Yeah.
So again, I think as an organization, we try to do right by our employees, and some of that, but also balancing and knowing that we have different job responsibilities. And so, as a leader, I think it's important that I show up, that I'm there. I was part of the gift card distribution process. Again, it just felt like the right thing to do. So I showed up and I was handing out gift cards along with some of our other staff. So I guess that's where equity is very important at Clifford Beers.
Yeah.
We also know that there are job responsibilities that have to be done from certain locations, and you have to then adapt to that.
Yeah, and you mentioned something really interesting. I talked to a lot of CEOs, and many of them have admitted they like working from home because they're not being interrupted as much, and they're really able to focus. But we have to remember that as leaders, there is an expectation that we too show up. And so I love that you're making that point.
Yes.
I am anticipating that a hybrid way of working is going to be the next disruption. In that it's going to require a new way of thinking. It's going to require a shift in the culture. It's going to require different equipment, right? People are asking me, and I don't know the answer, but I love that these things are surfacing, is how are we going to manage meetings when some people are at home and therefore on a monitor, and some people are in the conference room? How do you keep people engaged? Right, when they're in separate locations? And so I just wonder, how do you feel about do you think this is going to be another disruption, or do you think it's lasted long enough that we're slowly kind of getting used to things?
Yeah, I mean, I do think we're slowly getting used to things that we were forced to abruptly change course and remotely. In the early days of our pandemic, the early months, we had more meetings with our managers, directors, and different layers in the organization. We went back to weekly meetings, which we hadn't had weekly meetings with that large of a group in a long time, but we really wanted to ensure we were communicating well with a variety of levels in the organization. So we did that through a lot of Zoom meetings. Things have definitely slowed down and gone back to the more routine meeting structure and meeting time frames. I do think many of us miss being together. This Zoom stuff doesn't quite feel like the same level of togetherness. And the same kind of ability to kind of really establish and maintain relationships. So I appreciate that we're going to have the opportunity to spend some time together again in person. And, we're planning for any, just like the state, just like others in the state, we're planning on how to do that safely with people who are vaccinated and people who are not vaccinated. We're largely a child-serving organization, and so we know a lot of our population isn't going to be vaccinated. A lot of the kids in the schools that we're supporting are not going to be vaccinated. So there's a new normal, but COVID is still very much here, and we will continue to really have to maintain the protocols around safety and mask wearing and things such as that moving forward.
Yeah. So I want to highlight some of the things that were talked about 1 year ago on this show, right? Christine Dixon from Project Hope talked about how they were adjusting to this remote way of working, but that they also weren't rushing to get back into the office. Even though the shelter at place was being lifted, they felt that they needed to take the care and really think about what that would look like. They also developed a task force where they brought people together, a team of staff who were thinking through the logistics of coming back to the office. And there were some things that she talked about, making sure that the office space, that the desks would be reconfigured so that they were 6 feet apart. This is all before the vaccine. They did not go back to the office. They are primarily still a year later, they are still mostly working from home and offering their services remotely. However, they're slowly, it's almost like a pre-launch. Mm-hmm. Some of the leaders are going in, right? And so they do plan to offer a hybrid model where some will come in and some will will remain at home between the month of July and August. And then they're going to reevaluate then. And so you talked about that there is a hybrid now. Mm-hmm. Do you think you'll ever go back to what it was, Christine?
I don't think we're going to go back to what it was, where I every day, full time in the office. It doesn't. I think what the past year has taught us is that you can do a lot of work from home. We had conversations, Cynthia, you were in them in the past about like working from home, and can you do some of your documentation at home? And we were like, nope, everyone has to be on site, and paperwork this year gave us a very different perspective on that, right?
Yeah.
A very different perspective.
Yes.
I do think that we're going to find that hybrid is likely here to stay, and there will be this office and work from home hybrid in place for a long time. And Myra, I see your comment about isolation and like all of the balancing. And so, I personally look forward to having some time in the office with my colleagues again. I realized one thing I realized this year is I've been at Clifford Beers for more than half my life, 6 years, and I feel a piece of why I've been able to do this work for so long is because of the support I get from my colleagues. So I've really missed that, and so I look forward to kind of being on site, but also doing other work at home. So I think hybrid is pretty much here to stay for many, many nonprofits, I would say.
Yeah, I have to tell you, I really do miss going to your office. I miss your candy bowl. Mm-hmm. I used to eat all her candy, and then I would have to come and replenish it because I felt so guilty. And so when I come into my home office every day, I say hello to pretend coworkers, and you're one of them. So you are in my pretend space, nice. And know that we have great conversations.
That's all nice.
By myself.
I'm sure.
So I want to talk a little bit about, in the last couple of minutes that we have, costs. Are there costs? I mean, there were lots of costs associated with going remotely. Are there costs going hybrid or coming back that nonprofits should be thinking about?
Yeah. So again, this concept of hybrid and really made us all kind of evaluate our rental space.
Yeah.
And so, so we will experience some savings because of a change in our office locations. And I think that's something that, we have to kind of plan for and think about in the future. And then I also, we thought a lot about our IT needs with people working from home, and for our clients who, their Wi-Fi connectivity issues and their struggles. And so, again, some of our IT support was also, really thinking about how the families are going to navigate that moving forward. And so I do think, we had to invest in different platforms and different systems around IT. So that's a real cost. and having the adequate number of IT support staff is a real cost that you really have to plan for and think about. And then
That's interesting. So you've had to expand your IT department?
We expanded our IT department by a third this past year. Yes.
Wow.
So yeah. So again, facilities needs, IT needs, but then I think the other cost is really that we've all kind of alluded to is this kind of workplace culture, right? And work-life balance, and just how this is going to feel different moving forward, and things we don't yet know. I mean, I walked out of my office at 5 Science Park on March 18th, 2020. I never thought that here I am, what's today, June 4th, 2021, still working in my dining room. I would have never it took this long. So I don't know what the cost is to workplace culture yet. How staff retention going to be impacted? The people who joined us in the past year while we've been in a remote world, will they have a different level of kind of retention as a result? I don't know. How hiring and interviewing, did that work differently? We had, so I'm curious about some of those kind of like HR costs, I guess, also moving forward. So just a thought.
Yeah, no, there are a lot of considerations on the HR end, especially if you hired staff and leaders during the pandemic.
Right.
Who are now coming into the office and culture. I could talk about organizational culture all day. I think it's an amazing topic, but I think you highlighted something that's really interesting. What's going to be the cost to our culture? Yeah. So if you had a great culture or a good culture, does this compromise it, right? Having a hybrid or coming back, or if you didn't have such a good organizational culture, is this an opportunity to improve that, and how? Mm-hmm. So yeah, thank you for lifting that. Sure. And you seem really excited. You're back, you're role modeling it, but I know people who are still dysregulated, right? Who never quite got used to it, mm-hmm. right? And now they're coming back, right? And they have to find yet another way of working, not the way they did before, and not the way they did in the past 15 months, but now a new way of working. What's your advice? Yeah, what can you tell us about that?
So, again, we've been super intentional about, the impact on staff and what this transition a year, 15 months ago meant for staff. And then as we're kind of planning our return to a more intentional hybrid model, mm-hmm. So if the agency that you're with isn't intentional about it, start the conversations. You really need to be intentional around the services and what they're going to look like moving forward, the HR needs and the culture needs. And so if mm-hmm. facilities, IT, like if you haven't been really intentional about those conversations, make sure that you start now. It's not too late to start, I guess. I think the other piece, so at Clifford Beers, we're also very committed to transparent conversations and communication. And so, it was a struggle for me initially. I felt absolutely more isolated and I couldn't quite get my groove and I didn't know when I was working and it felt very confusing. I had very transparent conversations with some of my trusted colleagues to kind of figure it out and to do it differently. And so, so there's some vulnerability in having those types of honest conversations. But if you're still struggling and we know this is the new normal, this hybrid workspace is the new normal. And if you're still struggling, you got to figure it out because this is what's going to stay at this point. So we have to make this work and we have
to. Yes.
So talk to a trusted colleague, talk to a supervisor, talk to your human resources department if you need to.
Yes, yes, definitely. I love that advice. So, okay. And so so we're coming to a close. This 30 minutes goes really fast. But is there anything I haven't asked you that you have experienced that you think it's important to let other nonprofit leaders be aware of?
Staff feedback. So just going to say, keep asking, like we're doing staff surveys more now than we ever have before. And so it's really, really very important that we continue the conversations with our staff about how this is going.
I love that. I love that. And, let's also not assume that people are doing, are still dysregulated. While there are people that there are many people that have also adjusted.
Yes.
Right.
Absolutely.
So we don't have to overcompensate. There are people who are dying to go back to the office. I can't wait for us to open our doors.
Yes.
So that's awesome. And it's, it would be great if this could be our last conversation about opening our doors. I suspect that it is not. I suspect that we're in for a long journey, but what an incredible time in our history, and that we get to build it as we're living it. So thank you, Dr. Montgomery, for coming on. I so appreciate your insight. Thank you to our viewers and to their comments. And again, I just want to say how much I appreciate my co-host. This is a lot to manage, but I hope I did you proud. I didn't go too rogue, although I wanted to. But I hope Peter's having a great day off, and I hope Rebecca feels better. And so thank you. Until next week at 10:30 on Facebook Live. Thank you for joining Coffee Time with Masterminds. Bye, everyone.
Bye.